Hello, everyone, and welcome to Health Transformers. I'm Becky Longacre, your nurse gone health coach. And today I have my friend Chris White, who's the founder of Casco Bay Insurance, which specializes in Medicare and senior products to fill the gaps with Medicare coverage. Welcome, Chris.
Hi, Becky. It's great to be on with you.
Thanks for coming on. So, were you born an insurance agent, or how did you come to be an insurance agent?
So I graduated from college and I said, what am I going to do with my life?
Hmm.
So I was taking kind of pre-law going that avenue, decided I didn't want to be a lawyer. And I
Hmm.
said, what do I want to do? I want to go into, say, group benefits, pensions, things like that. So I went into the life insurance business after graduating from Boston University.
Hmm.
And that led me into group benefits. I never got it to the pension part because I was having too much fun.
Hmm.
But that's how I started. I was not born in insurance. I did not know where I was going to go after college. But when you go on commission only, you figure it out.
Hmm. Absolutely. You're highly motivated, I would think.
I've never had a paycheck.
Yeah. Okay. It's
Okay?
always been commission.
Absolutely.
Okay. Yeah. So, what are some challenges and rewards of being a Medicare broker?
I like that question. Why I really love what I do is because, first of all, the Medicare population, which is maybe 1 out of 4 people, are totally underserved. They can't get information about Medicare from Medicare.
Mm,
You're directed to an 82-page booklet.
yeah.
Still, there's questions on that. If you go to a Medicare company that sells the Medicare plan, they're not going to tell you what you have to do to enroll in Part A and Part B and what are the timing issues. So what's rewarding is I'm helping people with information that they most likely don't have. And there's not that many of us that do this.
Hmm. You're an expert.
I have to be.
Yeah.
Yeah. And there's some outstanding people that I know who do this.
Yeah.
And we're all friends and we all work together and we all know who each other are. So because there's so much need, it's just a vast population out there for us to help.
Yeah. So a lot of what you do is you do talks and workshops. So what can someone, if they were to attend a talk or workshop with you, what can they expect when they go to
So,
that?
so what I do is Medicare compliant education presentations, which are classified as education.
Hmm.
But that means we don't talk about products, we don't talk about rates, we don't talk about specific companies, we don't make comparisons, we don't have opinions. What we do is, I wish I had my booklet, but I basically, there's a booklet called Medicare and You that every Medicare beneficiary receives, and a Medicare beneficiary is a fancy name for saying a person covered under Medicare.
Hmm.
But um, a lot of people don't know they're Medicare beneficiaries until we tell them that they are. And they say, what do you mean? So I teach out of that book or I do a slideshow, and it's all to talk about when someone's eligible, how they're eligible, all these different questions that people have, timing issues, penalties. What if I'm working and I get Medicare while I'm working?
Hmm.
When do I qualify? So
Right.
there's I give those presentations. They're going to know when they leave that if they didn't get the information, I'm going to tell them the next time I see them, they can call me. But they'll have all that information in front of them, and then we do one-on-one consultations at their request sometime after that education presentation. So they know that when they leave there, they have an independent voice for Medicare that they can turn to and get all of their questions answered.
Awesome. Beautiful. So we went through some like common Medicare questions. So I'm going to move into the Q&A section of the interview where I'm just going to sort of like rattle off some questions that the most common questions that you get about Medicare. Okay.
Fantastic.
When can someone enroll in Medicare?
When that, most of the time, well, I'll get to the common answer, is 3 months before their 65th birthday and 4 months after, but it's actually a 7 month window. It
Hmm.
it's it depends on the day you were born in the month. But anyway,
Sure,
roughly three before and three after,
sure.
if they need to enroll in Medicare. So many times people don't have to at age 65. The other people who are on Medicare are people who are under 65 and who are on Maine care or
Ah,
Medicaid
yeah.
or have a disability
Hmm.
that's for the past 2 years if they're basically on permanent disability. So
Okay.
there's a lot of people that are covered under Medicare under age 65. I just met a young gentleman who's 26 years old. He
Hmm.
just turned 26 and he's on full Medicare. And it's there for him.
Okay. Awesome. So you had talked about penalties. And so I want to understand, so what is the lifetime penalty if someone doesn't enroll in Medicare by 65? Do they have a penalty?
So first of all, the long-winded answer is if they are working past age 65 and have a qualified group health insurance plan,
Hmm.
they can defer Medicare till whenever they leave the plan
Okay.
or retire or move on. And then if that company doesn't have a retirement medical plan, they can go into Medicare at that time without any penalties. However, if you're eligible for Medicare at 65 and don't have other insurance and you don't enroll in Part A and Part B,
Hmm.
you will have lifetime penalties that is roughly 10% a year, and that's a forever penalty. So if someone goes 2 years and they just woke up and forgot at age 67, I forgot to enroll in Medicare, they're going to have a 20% penalty on Part B of Medicare.
20% of what?
20% of what Part B costs at that
Okay.
time.
I
Right
see.
now, right now, Part B in 2025 is $185 a month for most people. There are other guidelines, but basically 185. The more you make, the more you pay. Or if you're on low income, it can actually be paid for, or part of
Okay.
that paid for.
Okay. So if you're eligible at age 65, you do not have any other health insurance, then you would get a penalty, is what I understand. But if you are
Correct.
65, 67, and beyond, and you're on a group health insurance plan or some other health insurance plan, you will not get a penalty.
Yes, it has to be a health insurance plan that's compliant. It can't be a medical sharing. We've heard
Yeah.
of these medical sharing accounts.
Yeah.
Um, if you're a veteran and you want to say I just worked with a veteran. I worked with a
Hmm.
lot of veterans, but they technically, if they don't have to take Medicare. They can get all of their care through the VA. However, this gentleman said to me, what if I don't enroll in A and B and I change my mind, in 2 years, 3 years, and then I want to get into Medicare? The answer is he then would have paid the penalty if he didn't enroll at 65 because he was eligible and
Yeah.
he didn't have a group health plan because
I
VA
see.
coverage is not a group health plan.
I see. Okay. How do people enroll in Medicare?
So the common way is for people to go on the Social Security website, create an account, which I have nothing to do with. But they
Hmm.
go in, and a lot of people go in and they have an account anyway because they want to know about their Social Security, get their statements. But there's a portal, a link that says enroll in Medicare.
Okay.
So that's how people do that. Now, here's another thing. If someone is drawing Social Security, and don't hold me, but I believe if it's at least 6 months or prior
Hmm.
before age 65, if they're already getting a Social Security check, that person's automatically going to be enrolled in Medicare A and B. And by the time their 65th birthday comes around, they're going to have a card, a red, white, and blue Medicare card with their number, and their eligibility date will be the first day of the month of their birthday. So they'll already be enrolled,
Okay.
but they have to exercise Part B.
Okay. And we're going to get into that in just a minute in terms of Part A and Part B. Um, so what is the Medicare open enrollment period?
The Medicare, okay, so there's two things that everyone can, what's going on now? We're on October 8th.
8th. Mm-hmm.
Okay, so annual enrollment period, AEP, is from October 15th to December 7th, Pearl Harbor Day, for year 2026. That's called annual enrollment period, but people commonly call it open enrollment.
Mm-hmm.
Now, not to and that's only for people who are existing Medicare beneficiaries. In other words, only for people already on a Medicare plan.
Okay. That's
Now
good to
that
know.
that not now we can get into specifics, but that's only for people on a Medicare Advantage plan or a separate prescription drug plan.
Mm-hmm.
Okay. There is a period from January 1st of 2026 till March 31st of 2026 that is actually called open enrollment period. It's a different enrollment period. I don't want to confuse people, but it's really from October 15th through December 7th. For
Okay. And that's for people that are already enrolled in Medicare. Is that
already
correct?
enrolled. That's correct.
So if you're new to Medicare, I'm 64 years old and I want to think about enrolling in Medicare, the open enrollment period is a longer period. Is that correct?
I didn't know you were 64 years old.
I'm making believe I'm your audience.
Okay, I'm kidding you. I'm kidding you. Of course, I knew that. So if you're 64 years old,
Yeah.
okay, here's the thing. If you can enroll, we went back to that when you can enroll. So 3 months before your 65th, 3 months after,
Yeah.
basically. So
Right.
you can
Okay.
enroll in Medicare any month of the year. It has nothing to do with what is called annual enrollment period, which is right now.
Okay.
Conversely, someone 65 or over coming off the group plan, the group health plan, that's qualified, it could be any month of the year. They don't have to wait for October or January. It's any month of the year they formally
Okay.
separate for service from service.
Awesome. Okay. So Medicare, I know that there's Medicare Part A, there's Medicare Part B, there's Medicare Part C and D, right?
Right,
So
right.
can you sort of like summarize all of these different parts?
Yeah, this will be a quick answer. So if you look in Medicare Part A is hospital only, everything
Okay.
to do with being hospitalized.
Okay.
And if you look in the Medicare book, it just says hospital insurance.
Okay.
Part B is called medical insurance. So that is everything basically outside of the hospital, your surgeries, your specialists,
Okay.
co-pays, therapeutic treatments, x-rays, the whole gamut.
Mm-hmm.
Then we jump to Part D. Part D is a prescription drug plan.
Mm-hmm.
So now you say, how did they squeeze C in there?
Mm-hmm.
So there are two ways to have Medicare coverage other than original Medicare. So Part C is one half of the answer. Part C encompasses Part A, hospital, Part B, medical insurance, and Part D, prescription drug coverage, in Part C, which is called a Medicare Advantage plan.
Okay.
One
Okay.
plan, one card, everything is included.
Okay. So it's comprehensive. C is for comprehensive.
That's it. That's exactly. I'm going to remember that the next time I give a presentation.
Okay. That clarifies things. Thank you.
Okay.
All right. All right. So you answered this question already, so I'm just going to reiterate what I heard, which is if you're 65 and you're covered under a group health insurance plan, you do not need to enroll in Medicare. There is no penalty.
Correct. I'm glad you answered that because I forgot to tell you that just because you're 65 and still working and on that group health plan,
Hmm.
that doesn't mean that you have to stay on that group health plan.
Hmm.
This is a lot of work I do for people. I will analyze a group health plan for those 65 and over if they're eligible, and I will compare that group health plan with Medicare, and
Hmm.
we will do an even off analysis of which situation is better.
Hmm.
What's important to know is in many circumstances, if I'm able to move the person for their medical off the group health plan, they still can continue those ancillary benefits of the group health plan, like life insurance, dental, vision. Some people have cancer coverage, some people have group life. In most instances, they're able to keep that going and then just switch the medical part over to Medicare. But that's when they have to actually enroll in Part B.
Right.
They will
And
have
Part
to
B
do
is the
that.
medical insurance.
Right, right. And pay for the medical Part B premium.
Okay. Okay. How much does Medicare cost?
So Medicare, there's a lot of different ways to look at the cost. The first cost when I do help people is determine what Part B costs.
Hmm.
I told you it's the standard is 185,
Hmm.
but without getting into specifics, and they change the limits every year. If people make more, and right now, if it's a single person, it's $106,000 of modified adjusted gross prior 2 year look back. So if someone in 2023 made over $106,000, then Part B will be more than 185 and it ratchets up. At this point, the maximum is hovers in the $600 range. So
Okay.
that can be a lion's share of your cost. The other cost is what is the copay and out-of-pocket maximum of a group health of a Medicare plan?
Hmm.
Many of these Medicare plans, the out-of-pocket maximum that you can pay in 1 year is anywhere, and this is very general, six to $12,000,
Hmm.
kind of like a group health plan. What's the maximum out of pocket? So that measures your cost. What medic now that does not include your prescriptions.
Mm.
In 2025, the maximum separate pocket for your prescriptions, if your prescriptions are covered on the formulary list, there's normally 5 tiers. After you satisfy $2,000 out of pocket maximum, including copays, coinsurances, and if there's a deductible part, then no matter what the prescriptions cost, that's the maximum you pay is $2,000. Now let me kind of switch gears here because we didn't talk about it, but we
Hmm.
probably will. There's another avenue into Medicare, and it's not Part C. It's not a Medicare Advantage plan. It's a good old-fashioned Medicare supplement. They
Hmm.
also are known as Medigap policies.
Hmm.
And those plans, there's many other letters. The most common letters are plan N is in Nancy and G is in green.
Hmm.
Now, plan G is just the most comprehensive plan for on a Medicare supplement. So
Hmm.
here's when you get into the out-of-pocket maximum uh, calculation. Plan G will pay all of your eligible Medicare expenses for hospital, major medical. It'll pay all of everything that A and B doesn't pay for
Hmm.
at 100%, except for in 2025, an annual Part B deductible of $257. So many of these plans range from $250 to $300 a month. And that is extra on top of your Part B of
Hmm.
whatever Part B costs you. So you're
Mm.
adding another 250 to 300 and they will change and they'll go
Hmm.
up. But then literally your out-of-pocket maximum on the medical side and hospital side is your monthly premium times 12
Hmm.
and then plus your $257 annual deductible. So
Uh-huh.
if that kind of makes sense, now that's not your prescription side. You also have the prescription $2,000 max. and if
So,
there's a premium for that prescription drug plan.
so Medicare Part C would cover hospitalizations, medical insurance, and prescription drugs. So that seems to me to be very comprehensive, but the monthly premium would be higher, is what I'm hearing.
So actually, it's the other way.
Okay.
But you got it. You got half of it right. But this is great. So many of these C plans, Medicare Advantage plans, which encompass everything we just talked about,
Yep.
A, B, and D, many of them have a zero premium. Now you still pay your Part B to Medicare, but the plan itself, unlike the supplement where I said there's an extra charge for 250 to 300 a month or more,
Mm-hmm.
it's a zero premium.
Mm-hmm.
Some have small premiums, $34 a month, $38 a month. Some do have 112 a month, but many of them have a zero premium. But then you actually, that's where you get into that out-of-pocket maximum if you have claims of anywhere from 6,000 up to 12,000 a year on the medical side. And
Mm-hmm.
then you still have the 2,000 exposure to the prescription side, but you have a zero premium
Mm-hmm.
for both the medical and the prescription.
And hospitalization. That
Yes,
includes
correct.
yeah, that's awesome. Okay. All right. This is why we have brokers like you, Chris, to sort of like explain all the things.
It's
Um,
rather now I'll tell you this. There's I get this. I don't care if someone's perceived as highly intelligent or not, but some of the most intelligent people I've spoken to, including many medical professionals and doctors, have the same question as everybody else. Just
yeah,
because they're in the field doesn't mean they understand Medicare.
right.
And they're not supposed to. No one really should have to go it alone.
Mm,
That's what great Medicare insurance brokers, my colleagues, and some of the other people that you know, Becky, that's what we're here for. The population is underserved,
mm.
and we're the people they can turn to for unbiased information and plan design.
So when people go to your workshops and talks, they do not pay for it, right? It's free for the community. Is that right?
Right. I also do adult education for some
Yeah.
cities and towns, and you know how they charge 15 or $20 and
Yeah.
for the person to show up. I just waive the fee and say buy more pencils and
Right.
paper
Right.
or ink cartridges.
Right.
That'll add up pretty quick. So no one pays to talk to me.
Right.
I don't charge a fee.
Mm-hmm.
If I help them enroll them in Medicare, whatever plan it is, if there is a commission to be paid by a certain insurance company, many pay commissions, some don't, they give me the commission and the
Mm-hmm.
renewal. What I want people to understand, I tell this, if you liked a certain company, and I won't name any companies, but if you wanted that company, if you call them up and enroll over the phone with somebody you don't know,
Mm-hmm.
never talk to again, you're going to get the same plan as I'm going to enroll with the same company. And then you have me to make sure that's the right company. And you
Mm-hmm.
have me all year long or one of my colleagues to when you do have all those questions. So
Yeah.
that's why an independent broker is your year-round information source for all things Medicare.
Definitely. So in the moment, you can ask questions and talk to a human, talk to an actual human.
That's right. That's
Yeah.
right. And I do meetings on the phone. I do Zoom meetings. I sit down at kitchen tables. I meet in coffee shops. I've been around, so
Yeah.
it's wherever is the best for the people.
Awesome. So I heard you say you're not going to mention specific insurance companies because my curiosity is, according to Medicare, what are the top performing insurance companies? That's my curiosity in
So
terms of
I
compliance and results and outcomes.
what you need to do is I can guide you to the research.
Okay.
These Medicare Advantage companies have star ratings up to five
Okay.
stars. and then they can explain how they arrive at that star level.
Mm-hmm.
A low star doesn't mean it's a poor company. It's just that their criteria for the analysis is not as uh, well documented or not as responsible or not reported as well as some of the higher star companies.
Mm-hmm.
So that's how you look at a Medicare Advantage or plan. If you're going to look at a supplement, you can look at ratings like AM Best is the life, that's the oldest one that rates life insurance companies because Medicare supplements are issued by life insurance companies. S&P does their own ratings. So there's a whole, I can point people to research, but I never give an opinion that
Mm.
one plan or company is better than the other
Okay.
because
And
that's not
that's
my
and
job. That's not my role. I'm not a biased person. I'm only going to guide you to where the research so you can make the best decision.
right. And Medicare is highly, highly regulated anyways. And so I think that that's part of your job as a broker, right? Is you can't advise people. Is that in
Right.
terms of specific
I can't
insurance?
recommend.
Right.
So here's the thing. I have a health insurance license.
Mm-hmm.
Just so people know this, it's important because when I talk to people, most people don't know an independent Medicare insurance broker. I know who they are, but most people don't. So not just any health insurance agent can market or recommend, not recommend, but advise or sell Medicare coverage, period. Now, a
Mm-hmm.
health insurance agent, any health insurance agent, if they're appointed with a company, can sell a Medicare supplement.
Mm-hmm.
But to sell Medicare Advantage Plan C and prescription drug plans, I have to credential every year
Yeah.
with the Center for Medicare and Medicaid Services, CMS, which regulate. So in addition to the health insurance license, I have to credential every year, and it's a rigorous process. If people are familiar with continuing ed for a lot of industries, this is a lot different.
Yeah.
It's really, we have to basically block off a week to 2 weeks a year to while we're running our practices to credential with Medicare. And then it's credentialing with each company that has the plans. That's another process. So the reason I tell you that is because that's what we're governed by is we provide as the accurate information that people request. We don't recommend Medicare Advantage versus Medicare Supplement. We don't recommend one company versus the other. We simply give the pertinent information for a person to make the best decision. And then they say, I like this plan, this way to go into Medicare.
Mm-hmm.
Now, if they reiterate something that I think they didn't understand, I'm going to say, well, let's go back and check this benefit. And just so you understand that. So we're very careful not to make specific recommendations, and we don't have opinions.
Sure.
The biggest question I get asked is, well, what would you do for your parents? So I can't tell you that.
Okay. Yeah.
So
Can I ask you, so you serve, it's Casco Bay Insurance Associates, that's in Maine. Do you serve people outside of Maine?
right. My company, Casco Bay Insurance Associates, is in Freeport, Maine.
Yeah.
My office is in Brunswick. I have another office up in Hollowell, about a 5 minute drive from the capital.
Hmm.
However, I'm appointed in other states. So a Medicare broker has to be appointed in each state. First of all, they have to be licensed in each state that they do business with, and then they have to be appointed with the company in each state. So that's why I'm able to help people in other states because of that relationship. And
Hmm.
because of Zoom and telecommunications, and not having to sit down at a kitchen table or you have to come into my office or meet in a coffee shop. I serve people in California. All the way to California. So, you
Awesome.
know, it's
Can I
really
ask,
referral basis.
huh?
It's pretty much referrals.
Yeah.
That's how I serve people in other states. I don't necessarily have marketing campaigns. I do have marketing campaigns here in Maine, but it keeps me pretty busy.
Yeah, awesome. All right, let me ask this question. So, in the state of Maine, I don't know if you can answer this as an insurance broker or not, as a Medicare broker, but what are the top performing hospitals according to Medicare?
Um, Again, I have to take the
Okay.
fifth on
Okay. So
that.
you okay, go ahead.
I can direct you to financials. I can
Mm-hmm.
direct you to a lot of research. See, here's the thing. We, all we do as this, I should have probably said this before. As an independent Medicare insurance broker, we literally only represent the company that has the Medicare coverage.
Mm-hmm.
We don't work with Social Security. We don't work with Medicare. We
Mm-hmm.
don't work with hospitals or doctors.
Mm-hmm.
We have all that at our disposal if people want, if they want to look at network lists and to make sure that their doctors are in network or the hospitals. But as far as the actual financial, that you'd have to get from that source.
I got you. Okay. What is IRMA?
Who? No. IRMA, IRMA. I
Yeah.
kind of touched on it, but I didn't call it by name. Income related monthly adjustment. That's a
Okay.
Social Security. That comes based, that's when I said, you know how the standard Part B is $185 a month. Well,
Yeah.
if you make high income, that IRMA will be more, the income related monthly adjustment. In other words, for the ability to make more money and the luxury of having to earn more money or have more income later in life, when we're on Medicare, we're going to pay higher because we have more money.
Mm-hmm.
So that's where the IRMA comes in, but it is capped. And don't hold me to it, but it's hovering in the $600 range.
Mm-hmm. You did say that before.
Yeah, but I didn't call it IRMA, so thank you for bringing that up. It's very important, and here's what we do. We make sure that's one of the first things when we're talking to somebody about Medicare and we have their permission. I'm never going to ask a financial question. I'm never going to ask a health question. The
Mm,
only thing I'm going to do is say, here are the guidelines for IRMA. Make sure you understand that and then seek your tax advice.
mm-hmm.
I will ask prescription drugs, but I'm not going to ask you why you take them. The
Mm-hmm.
reason I ask is so I can put them into the list to find out which company is going to cover them most efficiently.
Yeah, definitely. Um, and then one of the questions you had emailed me is, how do I get paid? Is that how do you get paid, or how does the person, the beneficiary get paid?
Okay, that's me.
Okay,
Most
okay.
people ask me at my workshops,
Hmm.
or it's always the elephant in the room because everybody's afraid to ask.
Mm,
So because it's kind of embarrassing. So how do you get paid?
yeah.
Because see, I don't charge a fee, but so that's what I do. I tell people up front, and when I meet people, I tell them. So there's no cost to talk to me.
Hmm.
You can call me whenever you want, but you have to sign a form by Medicare that says I'm allowed to talk to you.
Hmm.
But if the company pays a commission or a renewal commission, it's paid to me. So not all products pay commissions, but when they do, they're paid to me, the broker, whoever that broker is, and those commissions are regulated. So one of my other broker friends, I have a bunch of them. They're not paid any more or less. That commission is the commission.
Hmm.
It's paid out. Either they pay it or they don't, and it's
Hmm.
paid to us as brokers. And
Yeah.
that's kind of to take care of things. That's,
Hmm.
but it doesn't come out of the consumer's pocket, or you don't get a lesser plan because they pay me a commission.
Hmm.
So,
Definitely. Okay. All right. So you touched upon Medicare supplemental, also called Medicare Gap or Medigap, and then Medicare Advantage. And so my understanding, based on what you just said about Medicare Advantage, is it is A, B, and D. So it's hospitalizations and like outpatient medical insurance and drug coverage. That's Medicare Advantage.
yes.
And so, what is the difference between Medigap and Medicare Advantage?
Okay, so Medicare Advantage Plan C, on one, you'll get one card from
Yeah.
the company you sign up with, and it's good for all of your coverage,
Okay.
hospital, outpatient, major medical, and your prescriptions.
Mm-hmm.
Many of the plans have a zero premium.
Mm-hmm.
They all have out-of-pocket maximums on right now on the drug side, $2,000 for 2025. And then they range in the out-of-pocket maximums you can pay in any year on the medical side with the hospital of anywhere from $6,000 to $12,000 roughly. Okay. Original Medicare and a supplement slash Medigap and a prescription drug plan, what's going to happen is you're going to get two extra cards. You're going to get
Mm.
one from the Medigap Medicare Supplement Company,
Yep.
and then that you're going to pay an extra premium. We were talking about Plan G, paying
Yeah.
everything Medicare, filling in all the gaps of Medicare other than that small 257 annual deductible in 2025. So if you have a Plan G, that's you're going to get that card from that company and you're going to pay that premium and then you're going to get another one from a prescription drug company. It could be the same company, but it will be a separate card. Most of the time it's a different company. And then there'll be a premium for that. Some have zero premiums, some don't, but everything will change in 2026.
Mm.
So they all have a wide range of premiums and they still have that out-of-pocket maximum that you can pay that after you hit $2,000, then you don't pay anymore as long as they're on the formulary list.
Based on my comprehension of what you just said, it seems like Medicare Advantage C is a great plan.
Yeah, well, it is. There, you know what, Becky? There's no right or wrong
Mm.
answer in
Mm-hmm.
Medicare. I'm never going to tell you that's the right decision or it's not.
Right.
And I have many couples, partners that one has a Medicare Advantage plan and the other has a prescription drug plan with the prescription supplement. And it's personal choice.
Mm-hmm.
But the trend is that I see, and you can talk to other Medicare brokers, is generally people who get into Medicare at this point at 65, I would say people ask me this all the time. About almost 40% of the people I meet who enroll at 65 are buying a supplement and paying the extra. The other 60% are getting the zero premium advantage plans.
Mm-hmm.
Now, some of what goes into that is there is more choice with
Yeah. The
Medigap
supplemental.
slash supplement because there are no networks because
Right.
you can go to any doctor, specialist, hospital, surgery center that accepts and bills Medicare, and you don't have to there's no network. Whereas the Advantage plan, you have networks to deal with. No matter how great they are or robust, there still are networks to make sure that your
Mm-hmm.
doctors and hospitals are in that network. And the other generalization is that people who are experiencing health issues at 65 many times will go the supplement avenue because they feel they're going to have a lot of treatment and they want
Mm-hmm.
to have all the choice
Mm-hmm.
and their out-of-pocket maximum for the year for Plan G will only be the monthly premium times 12
Yeah.
plus the $257 annual deductible, whereas they could be
Right.
facing $6,000 to $12,000 on a Medicare Advantage plan with a
Mm-hmm.
zero premium. So a lot of people look at it that way, but not
Right.
everybody. But
Right.
that's that's
Yeah. How
how it
how
works.
many meds are you taking? How many times do you have to go to the hospital? How many surgeries do you have? How many doctors do you have on your team? Those are all decision makers.
Right.
Right.
And I just met with a friend yesterday in Westbrook who I've known for 3 years.
Mm-hmm.
And he got diagnosed 4 months ago with non-Hodgkin's lymphoma.
Mm-hmm.
He's already had a horrendous treatment. He's going back to Boston for a month
Mm-hmm.
next week. He's in the middle of enrolling in Medicare. He enrolls for December 1st. We looked at it carefully, and his decision with his wife to help was to just get a supplement.
Hmm.
because he's facing incredible bills ahead. So he
Yeah.
knows that he's limited to that supplement premium and there will really be no other out-of-pocket maximum. And he
Yeah.
has the choice. He doesn't know where they're going to send him for specialists, so he doesn't want to wonder if a doctor or hospital is in the network. So
Hmm.
that's what I see, and it's I was glad I was able to help them.
Definitely. Yeah. Financial stress when you're sick is terrible.
And they put
Terrible.
on a good smile. It's like, hey,
Yeah.
bless his heart. So yeah.
Yeah.
But yeah, I know them well. Yeah.
Yeah. Okay. Okay. And my understanding of what you're telling me is the answer is no to this question, but let me see. Do I have to buy a prescription drug plan if I don't take medication? The answer would be no, right?
You do not have to. Let me give
Yep.
you a funny example.
Yep.
So, if you're eligible, it goes back to the whole thing if you're eligible. So, if
Hmm.
you're eligible at 65, you could buy a supplement. You could go on and, because you have to buy the extra plan if you want it.
Hmm.
But if you don't have to buy a supplement. So, I met a guy, he's a well-known realtor in Maine. He's really well known. Um, And of course, I'm not going to give you his name, but
Do I know him
he
too?
he actually came to me last year at this time
Hmm.
because I was doing my radio ads, and he came to me and said, "Hey, can you look at my prescription drug to my Medicare supplement?" And I said, "Yeah, well, let's look at it." So he had a great plan with a great company. So I said, "So who do you have your prescription drug plan with?" He goes, "I don't need one. I don't take it. I have that card, that RX card. I'm in good health." He's 68,
Hmm.
67. He
Hmm.
was eligible at 65 when he bought a supplement. He just says he didn't know. He
Hmm.
did not know this. This well-educated, successful person, he just didn't know
Hmm.
that if he deferred it, first of all, for the last 2.5 years, he had no prescription coverage. He was at the mercy, but of whatever happened, but it didn't happen.
Hmm.
But what did happen is there's a lifetime penalty for not enrolling in that separate prescription plan. And
Hmm.
it's basically 1% a month of the standard prescription drug plan cost. So remember I said they range anywhere from 0 to 112,
Hmm.
120 a month. The standard one then was about $26. So the calculation is they went back 32 months or 28 months, however long he was eligible, and they came out with this penalty. So I enrolled him in a very low prescription drug plan,
Hmm.
but his lifetime penalty is like $30 a month
Hmm.
forever just because he didn't do it in time. But I said, you know what? That's not the problem. The problem is you didn't have a prescription plan if you really needed it. So
Hmm.
he was very help he again, people don't know because it's so complicated.
Yeah,
That's why we're here. So
definitely.
yeah, but it's real life examples. You don't have to enroll in one.
Right.
But if you enroll in a Medicare Advantage plan, most of them have the prescription drug coverage. So
Yeah.
you're going to get it. So
Okay. You don't have to worry about it.
yeah,
And if you have questions, ask Chris White and he's
yeah,
going to help you.
I'm going to help you. And if I
Yeah.
don't know the answer, I can get it by the end of the day. I'll get the answer.
Yeah. Okay. So, how do people find you if they want you either to put on a workshop, a talk, or if they want to personally ask more questions about Medicare?
So my website is people out of Maine don't understand this. It's cascobayassociates.com.
Hmm.
We all know how to spell Casco Bay here.
Hmm. I'm
But
going to cut and
for
paste it.
those of you listening in Des Moines, Iowa, it's CASCOBAY associates.com.
Yeah.
So I do have a Calendly on that. So you can book a free consultation. Just go to the list. I also have a phone number. It's also on the website. It's 207 200 8304. And my email's on there too, chris@cascobayassociates.com.
Awesome. Um, Is if there is one more thing that you would like to tell someone who has questions about Medicare, is there one more thing, or do you think we've covered it all?
I think we've covered it. There's always one more thing, but I can't think of anything. We've touched on really kind of some different unique situations. So I just want people to understand, and I've thought of the one more thing. My passion is for people to understand the difference between a Medicare supplement and a Medicare prescription drug plan versus a Plan C Medicare Advantage plan because they don't communicate to each other. They don't coordinate. They're totally two avenues into
Mm-hmm.
Medicare.
Mm-hmm.
Um, the other thing that I want people to understand is, well, that part B is if you have a good financial advisor or tax person, you're going to know before you retire or what the IRMA is, what that income related monthly adjustment is.
Mm-hmm.
But that's my passion is really the two different ways to go into Medicare.
Awesome. Well,
So
Chris White, thank you for joining us. And I'll make sure that I have your website in the description so that people can find you. They can ask questions if they need.
I love to take them on. So that's what I do. I answer a lot of questions all the time.
Thank
So
you.
thank you for inviting me on, Becky. This has been really a lovely time, and I really appreciate it.
Thank you.